Hi, I'm Tate Shanafelt, a physician and professor of medicine at the Mayo Clinic. Today I'll be discussing our paper published in the Mayo Clinic Proceedings titled Longitudinal Study Evaluating the Association Between Physician Burnout and Changes in Professional Work Effort. The U.S. faces a large projected physician workforce shortage over the next decade. The U.S. Department of Health and Human Services actually projects that there will be a shortage of approximately 45,000 to 90,000 physicians by 2025. Physician burnout is another factor that may influence the adequacy of the physician workforce. Recent national studies suggest that over half of U.S. physicians are experiencing professional burnout. Some studies suggest that physicians experiencing burnout report that they intend to cut back on their professional effort. But it's unknown whether those reported intentions translate into actual behaviors. And that was the focus of the current study. In this study, we evaluated approximately 3,000 physicians working for Mayo Clinic over a several-year interval. And we looked at how their experience of burnout and professional satisfaction at different time points correlated with actual reductions in professional work hours and work effort over the following 1 to 2 years. And I think the first thing that was notable is that between 2008 and 2014, we did see a statistically significant increase in the percentage of our physicians who were working less than full time. And what was most notable there is that it was male physicians, and particularly male physicians over the age of 55, who were more likely to cut back their work hours. So I think counter to a stereotype that it's women physicians only, or that it's millennials, younger physicians who are in two-career relationships or want better work-life integration that are more likely to cut back on professional effort. In our actual experience, it was male physicians and older male physicians who are more likely to be having a reduction in professional work effort. The most striking finding was that each 1-point increase in burnout on a 7-point scale with a validated metric, or 1-point decline in professional satisfaction, was associated with a 30 to 40% increase in the likelihood physicians would actually cut their professional work effort over the following 24 months. And we saw similar changes when we looked at the analysis at the level of individual physicians who experienced changes in their burnout or satisfaction scores over a 2-year time interval, and what happened following sort of that second time point. So although reducing professional work effort may be an effective strategy for individual physicians to have more control over their professional life and achieve better work-life integration, it has potentially important repercussions for the adequacy of the U.S. physician workforce. And it does appear that the increase we are seeing in physician burnout nationally is going to have very important implications for the adequacy of that workforce going forward if we don't find effective ways to reverse that trend.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.